Good afternoon, everyone. In the framework of this Counter Child Trafficking Global Online Conference, I'm pleased to make a presentation now about using an online case management tool to track and measure child domestic servitude in Morocco. Let's start by a short story of terrorism in Morocco. Long story short, we started in '65 with first interventions mainly on medical assistance, then we opened a delegation in '76. During the '80s, we concentrated on specific child protection issues, but we focused first on the assistance to single mothers. But we could see that most of the single mothers were former housemaids or housemates, and so we handed over the Single Mothers Project to local partners with which we still work with, and then we concentrated on domestic servitude and on the risk of the exploitation of children through labor, mainly on domestic labor and also agriculture works. And today we are at the phase 3 of our work to prevent and protect children from exploitation through labor. The project team gave the name of Winarouz to this project. Winarouz means in Tamazight, in local language, holding hope. This project is co-financed by the Spanish Corporation and Terrorism, and we have 11 project staff working for Terrorism, plus 20 local staff working with partners in the 10 rural and semi-urban areas which are located in the south of Morocco, in Agadir and Taroudant regions. We divided in three the type of target groups with high risk of exploitation, risk factors and children at risk of exploitation, and also the children which are victims of exploitation. We adopted a multidisciplinary approach with some reintegration activities, including social work, school, economic alternatives for the families, sensitization, advocacy activities as well. Then we were in need of improving our case management, and that's the reason why we created and configured Pillango platform to do so. So Pillango is a software platform which has been designed especially for humanitarian interventions. So the French software editor Wopata developed this platform for not only case management but also for medical patient record, trainings, etc. etc. You can check the information on the websites which are indicated at the end of this slide. The module for case management is following the workflow, the steps which are followed by the social workers at the moment that they register, detect and register the child, they assess the situation or the assessment of the risks, the design of the action plan within the team, and also the review of the action plan as the action plan is being implemented and need to be reviewed up to the closure of the case. A project to protect children at risk or presumed victims of exploitation has to be implemented within a team. So the interest of this platform is that caseworkers can manage cases in collaboration with other team members. The information about common cases are located in a single and secured location and is always accessible by authorized users. In this way, we keep also the security of the information. Project managers can have a real-time overview of cases, progress and workloads, which is helping as well to supervise if the cases are followed carefully and if they are followed regularly. And caseworkers and project managers share a common vision of the cases. Now let's go into the daily work of a social worker using this kind of software, Pillango, online software. You will see that in the next slides, you will see that we'll follow the basic steps of how the child is registered, the family, etc. etc. Then you will see that one of the crucial points is the identification of the caretaker, the inclusion of addresses of family members, and also the evolution of the family structure, which is quite important in terms of social follow-up. one of the interests as well for this Pillango platform is to have a simple form to register all the data regarding the child and his family and the story of the child, the risks, plus the action plan. This is the usual entry point into the database where you enter the basic data of the individual. Just after that, you enter the information regarding the case management team, who is the reference worker, when the child has been identified, what is the source of referral, and the reason for the referral. Once the child is registered, you can also register all the family members. So you can include brothers and sisters, uncles, grandparents, etc., etc. At the end of the registration process, so you have not only the data regarding the child, but also about the family and the clear identification of the caretaker. To my eyes, one of the added value of this platform is to register not only the protection concerns, but also the environmental factors, which is helping in better assessing the situation of the child. So not only the issues putting the child at risk, but also the protective and the risky elements of the environment in which the child evolves in. Of course, on the top of it, you have standard assessment grids for cases allowing for comparisons. In this screenshot, you have an overview of the case, and you can see that nearby the photo you have the level of vulnerability of the child, which is now based in orange, so it's medium level. You have the information regarding the status, the addresses, the ID code, the family members, and down, if you see the protection concerns, which is still under orange and medium, you have the information regarding the assessments related to the family, to the health situation, to the social aspects of the child. Now you can see the assessment page, then you will see the information regarding the family. We have to precise that all the criteria which are indicated here, where you have to rate from low, medium to high, have been decided within the team. Following the same principle, this is the child environment assessment, and you can see that this is moving from good, average to poor. And you can see also the criteria which have been agreed by the team, like for example the quality of parenting, the family relationships, the discrimination and hostility based on their race, religion, ethnicity, etc. One of the interests of this tool is the combination of different tasks for the social workers. Not only it's encouraging them to analyze the situation of the beneficiaries in a better way, but also the assessment of the environmental factors is really refining the analysis of the situation, and in the same time you can redo the assessment several times in order to see the evolution of the case. Here is the very simple view to see the different assessments of the evolution of the risk of the child. You see the blue line, which is the protection line, and so the evaluation of different level of protection of the child according to the time and the different assessments. And then in parallel you have also the red line, which is the risk level and how the level are evolving and reducing. Any case management system needs an action plan. So one social worker or several social workers can record all the actions which are undertaken in order to improve the situation of the child or the family, the environment. Then in this way they can better plan the work, putting deadlines, having reminders, to have in a glance what has been done, what will be done for the case, and they work together to follow up this action plan. We are now on the page for the action plan. With still the basic information regarding the child. You see an indication of the cost of each action, which can be integrated case by case by the team. Then you can see as well in the first two lines of the action plans that in yellow are the reminders of the actions to be implemented. It is always difficult to follow a child when he or she has been referred to another association, another service, a health center or a school. Then in the database there is a system foreseen to follow the referrals. This is the page of the referral when you can see that the starting date, the ending date is also, it could be also undefined. Dedication to whom the child has been referred and the purpose of the referral. One of the main questions which is asked by the social workers is what about the paper file? The difference between the paper file and this kind of tool which is online and the database, etc. etc. So one of the answers to this question is that social workers are keeping a paper file which is on which they work daily, but also they can also daily register notes and observations regarding the child they are following. In this way, case notes are very useful, and in this way you can document the history of the child in a more narrative way than only the database, entering basic data. And notes are shared amongst all authorized case workers to build a multi-dimensional understanding of the child's story. We are not talking about double work. We are talking about in the paper notes having all the information recorded by the social worker. But on the database, on Pillango, the social worker will include the basic information, the more essential ones, the ones which are important to be followed by the social worker or one member of the team. To close a case is always a concern. So to improve the objectivity, caseworkers have to go through a checklist for each case, and this is encouraging them to assess key dimensions of the case. At the same time, to improve accountability, project staff can justify why it was decided to end the intervention. This is the closure checklist. Then you can see that Terre designed its own elements in the checklist. One of the first elements would be the case closure for reasons outside of terrorism control. Another element would be related to the communication that's been done with the parents or the child regarding the fact that we will close the case. It means that we will stop assistance. We included also the accountability mechanisms and other elements. Let's go now to the bigger picture. We are talking about the use of Pillango in terms of supervision of the quality of the works, but also how to use the statistics. Let's start by the positive elements of the Pillango platform on supervision and monitoring purpose. First, Pillango allows the dashboard to provide tools to access all cases and see recent activity. Case status allows for following cases with the case management process. Case closure is a two-step procedure. Case workers propose and project managers validate the closing of the case. Then statistics provide real-time project metrics and their evolution over a selected period of time. Here is the user dashboard where a social worker can have in a glance basic information about each case, the activity stream. In the same user dashboard you can have the list of all the children with a clear indication about the level of vulnerability of each kid by color, indicating in green when it's low, orange when it's medium, and red when it's high level of vulnerability. By scrolling down, you can see all the children within the project. I will show only two slides regarding statistics, here with the number of cases, and then you can see on the top right of the page the kind of criteria that you can choose in order to develop statistics regarding children in the project. So the previous slide was statistics regarding a timeline, and this slide is showing repartition of cases. As you could understand, Pillango is not only a database an online database, but also case management, which is online. So Pillango fully leverages the fact that it is online. The centralized list of stakeholders allows for each case worker to benefit from the services identified by others and eases resource mapping and referrals. I would say that, to my eyes, one of the most important parts is that case data is shared amongst authorized users, allowing for a collaborative case management approach. One of the interests of having a team working on an online database or online case management tool is, for example, the list of all the organizations that the project is working with to make referrals or to collaborate. Another interest is also to use the information regarding all the individuals which are registered within the database. They could be individuals like advisors or focal points, or they could also be beneficiaries, caretakers, relatives. Pillango provides the best of both aspects, a standard tool that fits to a specific context. The steps of case management are built in, and each case is managed according to these steps, and it reinforces the case management methodology amongst the team. One of the main questions asked by project managers would be, how can this tool fit to my specific context? The fact that is that Pillango is customized according to the context itself of intervention. You integrate, the team integrates protection concerns, environmental factors, the criteria for the closure checklist, etc., etc. And the customization should be done as a participatory activity, reinforcing the ownership of the tool. It means that when you have social workers working on the database, they work on criteria that they decided within the team. These are the examples of the criteria on which the team is working to design the database. For example, factors related to family, health, abuse and neglect, social factors. And once all the members of the team agree about clear criteria, it is integrated into the database. This kind of tool has to be easy to use, so a lot of efforts have been done by Wopata and Terre to make it user-friendly. So first we have a standardized user experience. Users learn how to do things only once, which is easing the learning curve. And it's also streamlined data entry, so no need to go back and forth between sections to input new data. The conclusions I propose now are the ones of a team of 2 experts who came to Morocco last June to evaluate the impact of Pillango tool on the practice of the street workers of Winarouz project. And the first observation was that Winarouz team appreciates Pillango for its contribution to the case management practice. Second one was the high level of record keeping, indicating both a comprehensive knowledge of the situation for children and of case work practice, and by extension, case management. One of the experts was giving an example. A record of a counseling session demonstrated a very sophisticated understanding of the dynamics of separation. Assessments and case plans seen demonstrated that a holistic approach has been taken, with assessment and plans framed in terms of objectives and needs of children, rather than services to be provided or actions. Other observations made by the expert: significantly regular reviews were included. Reviews are often absent, and their presence tends to suggest a clear understanding within the team of what they are doing and of the case management process. The team members were able to articulate the purpose of adopting a case management approach, and also saw a value in adopting a team approach to their work. This also includes challenging each other's practices, a very healthy environment. And to conclude this presentation, at the level of the vision, wider environment and broader operational context are important factors which directly relate to the impact, relevance and efficiency of the database, over and above the format and functioning of the database itself. Such factors include the way in which the database is introduced, staff is prepared and supported. And of course, above all, the development and introduction of Pillango is to be done with clear case management guidelines. This is now the end of this presentation. Thank you very much for your attention, and sorry about the French accent. For further information, please consult the website and emails indicated on this last slide. And you can also leave a comment through the conference website. I hope you found it useful and that some elements were corresponding to your interests. I would like to thank the organizers of the Global Online Counter-Child Trafficking Conference to give me the occasion to present our new online case management tool developed by Wopata and Terre. Thank you and goodbye.